Understanding out-of-network versus in-network coverage. Imagine you're a savvy shopper. You're browsing the aisles, tossing essentials into your cart, and you stumble upon a bottle of water that costs $5,000. What do? You probably laugh it off and move on, but what if that bottle of water was actually a doctor's visit and you're stuck with the bill? Welcome to the confounding world of out-of-network healthcare coverage. Today we're unraveling the difference between in-network and out-of-network coverage, a topic that's as confusing as deciphering ancient hieroglyphs, but way more important for your wallet. We'll dig into why these networks exist, how to navigate them, and what the experts have to say about making the best financial and health decisions. Plus, I'll share some real stories from people like you who face the same tough choices. By the end, you'll not only understand these insurance terms, but also know how to use this knowledge to your advantage. 1. Why do networks exist? In the simplest terms, networks are like exclusive clubs for healthcare providers and insurance companies. When a provider, doctor, hospital lab, joins an insurance company's network, they agree to offer services at a discounted rate to the insurance company's members. It's a win-win for the insurance company, and the insurer saves money, and the provider gets a steady stream of patients. But what's in it for you, the patient? In-network providers generally cost you less out of pocket, thanks to these pre-negotiated rates. However, venture outside this club to an out-of-network provider, and you could be hit with astronomical bills because there's no pre-agreed rate. In other words, you're paying the sticker price. I recently read a story from a mum on a forum who had to take her son to an out-of-network specialist for a rare condition. The bill? A whopping $27,000. The kicker? Her insurance covered only $5,000 of it. That's the financial equivalent of seeing a snake in your backyard and then realising it's a python. 2. The financial implications of going out of network. Let's break it down with some real numbers. When you visit an in-network provider, you typically pay a co-payment or co-insurance, plus any deductible. For example, if your insurance covers 80% of an in-network service, you're left with 20% of the bill. Sounds manageable, right? Now let's say that same service is out of network. Your insurance might cover just 50%, or worse, nothing at all, leaving you with the bulk of the cost. And don't forget the lovely balance billing, where the provider can bill you for the remaining balance after the insurance payment. I came across a user who shared that their in-network ER visit cost around $200 after insurance. A similar out-of-network visit during a vacation racked up over $1,500. The difference? One hospital was in-network, the other wasn't. They joked that they were almost tempted to fly back home for cheaper care next time. The irony isn't lost on me. 3. How to find in-network providers. You don't have to be Sherlock Holmes to find in-network providers, but it sometimes feels that way. Start by logging into your insurance company's website. Most have a Find a Doctor tool that lets you search for providers by specialty, location, and network status. Also, call ahead to the provider's office to confirm they're in-network. Networks can change faster than you can say deductible, and it's always better to double-check. Pro tip: download your insurance company's app if they have one. It's like carrying a directory of in-network providers in your pocket. And always ask if the specialist your doctor refers you to is in-network, because sometimes they're not, even if your primary doctor is. I once read a post from a guy who went to a hospital ER that was listed as in-network, only to find out later that the radiologist who read his X-ray wasn't. His advice? Always ask if everyone touching your file is in-network. It sounds extreme, but his $3,000 bill convinced me he might be onto something. 4. The grey zone, emergency care. When it comes to emergency care, federal law, the Emergency Medical Treatment and Labour Act, or EMTALA, mandates that hospitals must provide treatment regardless of your insurance status or ability to pay. But that doesn't mean your insurance will cover it fully. Even if the ER itself is in network, the attending doctors, surgeons, or anaesthesiologists might not be. This scenario often leaves patients stuck with out-of-network bills after an emergency. A user shared a horror story where they broke their leg skiing and were airlifted to the nearest hospital. The hospital was in network, but the helicopter wasn't. The result? A $40,000 air ambulance bill. They said it felt like they'd been hit twice. Once by the accident, and again by the bill. 5. Appeals and negotiations. You have options. If you do end up with a huge out-of-network bill, don't assume you're stuck with it. Many insurance companies have an appeals process, and providers are often willing to negotiate. Start by contacting your insurer to ask for an exception or appeal. Be persistent. Sometimes providers will offer a cash pay discount or set up a payment plan to help ease the financial burden. I read about a woman who got a $12,000 bill for a specialist her primary doctor recommended. She appealed to her insurer, arguing that no in-network providers were available for her condition. It took months, but they finally covered 90% of the cost. It was a reminder to always advocate for yourself. 6. Understanding your plan. HMO versus PPO versus EPO. Health plans come in various flavours, each affecting your in-network versus out-of-network options differently. HMO, Health Maintenance Organisation. These plans usually require you to stay in network unless it's an emergency. They often require referrals to see specialists. PPO, Preferred Provider Organisation. These offer more flexibility, allowing you to see out-of-network providers at a higher cost. Referrals aren't needed for specialists. EPO, Exclusive Provider Organisation. These plans are a mix of HMO and PPO. You don't need a referral to see specialists, but you must stay in network unless it's an emergency. A forum user described choosing a PPO plan specifically because their therapist wasn't in network. Their insurance covered 50% of the visits. They considered it a win because it let them keep their preferred provider while managing costs. It's a perfect example of how a little planning can go a long way. 7. Telemedicine and out-of-network coverage. The rise of telemedicine has been a game changer, especially during the pandemic. Some telemedicine services are covered by insurance even when the providers are out of network, or they may offer lower cash rates. If you're struggling to find an in-network specialist, this can be a good alternative. A user on a forum mentioned using telemedicine for mental health support during the pandemic. Their insurance didn't cover the sessions, but the cash rate was $80 per visit, a fraction of what an out-of-network therapist would charge in person. It's worth exploring, especially for specialised or mental health care. 8. The expert's take. Healthcare experts unanimously agree on one thing: clarity and communication are key. They recommend that patients educate themselves about their plans before they need care. This means understanding your benefits, keeping track of in-network providers, and knowing how to appeal a denied claim. According to a recent study, almost 20% of ER visits resulted in at least one out-of-network charge. Experts suggest that policies like the No Surprises Act, which protects against unexpected out-of-network bills in emergency situations, are a step in the right direction. However, patients still need to be proactive. We've covered a lot, so let's summarise. In-network versus out-of-network. In-network providers have pre-negotiated rates with your insurer, saving you money. Out-of-network means higher costs and potential balance billing. Why networks matter? They keep costs predictable for insurance companies, providers, and, ideally, you. Finding in-network providers. Use your insurer's tools and confirm directly with providers. Emergency care and out-of-network bills. Know that even emergency services can result in out-of-network charges. Appeals and negotiation. Don't give up if you get a huge bill. There are often ways to reduce or negotiate it. Plan types. Understand your plan, HMO, PPO, EPO, to know your coverage limits. Telemedicine, a cost-effective option, especially for specialised or mental health care. Healthcare in the US is a minefield, but understanding your coverage options is like having a map. the more you know, the less likely you are to be blindsided by an outrageous bill. If this article helped you navigate the maze of in-network versus out-of-network coverage, hit that subscribe button for more insights on US healthcare, personal finance tips, and real stories from people just like you. Don't forget to check out the links in the description for additional resources and tools to manage your healthcare better. Stay curious, stay informed, and don't let the system get the best of you.